Okay, so this is our first recorded session where I'm going to talk specifically about material that's in a chapter. This is going to be going over chapter 1. And before I do that, I want to give you some steps for how to think about how to study each chapter. So the first thing I recommend is that you read the chapter and pay careful attention to those things that are in bold or highlighted. You'll want to slow down and look at those carefully. Then I want you to listen to the recorded session, which is what you're doing now, listening to this. And I'm going to try to emphasize some areas that I think are important that you'll want to think about in your practice, and hopefully offer some examples. Then I think I'm going to include the full slide set because I like the slides that came with the textbook. They offer several questions as you're studying the material, and it can be a little study aid or some review material that you can use to help you retain the information. So take a look at that and try to answer the questions in those slide sets as possible as a way of studying. And if you don't know the answer, go ahead and look it up. That whole process is studying. The last item there, complete the assignments and of course transfer your workbook answers into Blackboard, and you'll see where to do that in the course shell. So let's think a little bit about learning before we get started here. I find this learning pyramid really helpful. So when you look on the left there and it says average student retention rates, so this is how much, you could think of it as if this is how much we remember from sitting in a lecture, reading, looking at an audiovisual presentation, maybe watching a demonstration, having discussion, so on and so forth. And you can see our retention increases as we do these other things. Simply sitting in lecture, which I've done decades of that as a student, sitting in lecture, we retain very little. Reading, we don't retain that much. Often we have to read over and over and make notes and things like that to help us retain. Audiovisual, that's a little better. Demonstration, getting closer. We tend to remember things if we're involved in actually doing something or watching something happen. Discussion, that's very engaging, and hopefully we can replicate some of that in this course. Practice doing, that's actually trying something that you've just maybe watched and seeing if you can do it yourself. And then the mastery level where you're going to retain the most is when you actually teach someone else. So one of the mantras that I went through as a student at a teaching hospital when I was studying nursing was the see one, do one, teach one mantra. And as we're using our skills, for example, how do we take a blood pressure? We're going to see one, hopefully in a video. We're going to do one and practice. You can practice on family or friends. You're also going to have a practice session towards the end of the semester. And then you're going to teach someone else how to take a blood pressure. And if you do all those three things, you'll feel quite confident that you know how to do that skill. So that's just an example. So think about this as you're studying and think about things that you can do to enhance your ability to remember the information. This chapter, let's talk about some big picture ideas. So let's look at the traditional healthcare system, and I hope you can see this graph. It's pretty good. I like it enough to put it in this discussion here, but you can see that they have facilities, providers, and payers kind of involved in hospitals. They also talk about who's in the hospital. You have sometimes you have nursing homes or treatment centers affiliated with hospitals. They're staffed with doctors and nurses and other folks. All of this leads to a very high cost. So especially these days, people have very complicated conditions. We have a lot of high cost interventions. So the costs need to be managed somehow and controlled. Well, they're not really controlled, but administered. So we've got all these different entities that do that administration. We have health maintenance organizations, we have PPOs, and we have managed care. This helps to deal with the high costs of hospital environment. One of the other things that has happened out of those high costs, in addition to these managed care programs, is the phenomenon of home health care. So people are leaving the hospital sooner with more complicated situations and in which they need some kind of home provider who can help them with all kinds of things, activities of daily living, dressing changes, maybe medication, understanding their medications, all those kinds of things. So most of the time with home health, you have a nursing uh, a person with a nursing background who's oftentimes the manager, the case manager for the patient, and then there'll be various different folks that work with her to coordinate that patient's care. Sometimes there's specialized therapies like physical therapists. Sometimes there's certain medical equipment clients have to have in their homes, like a hospital bed or some special assistive device that they need. And that the nurse will often coordinate with home health aides to provide and support that client in the home environment. So that's where the home health aide field sort of grew out from, was in a way of looking at our big healthcare system and how did we end up where we are today with this tremendous need actually for folks that are specialized and trained in the provision of home health care. So hopefully that gives you a little bit of a sense of where you are and where you might fit in to the big system. So one thing that you're going to do, and I left these all in here, these definitions. I want you to be really clear about how to use these definitions. You'll have terms like providers. You'll need to know what that means. It's often just a general term that includes all kinds of different specialty folks, from medical doctors to nurses to different types of clinicians. You can even refer to a provider as, an entity or a clinic, a point of care. Facilities, that's another term, talks about there's all kinds of different facilities: hospitals, long-term care centers, assisted living facilities, various treatment centers, burn centers, all kinds of things. So you'll want to be familiar with that, and so on and so forth. I'm not going to read all of them to you, but I want to point out long-term care. That's a place where folks go when they need 24-hour assistance, and there's typically at least one, if not more, RNs on staff. Um, Assisted living, this is where you have some help with your daily activities as a client there, but there's still a lot of things that you can do independently. And since the 1980s, we've made a move towards more assisted living environments. People really want to maintain their independence as long as possible. So assisted living is probably the most popular at this point. Long-term care centers still exist and are very important, especially as the client needs more advanced types of care. Adult daycare, some of you might be familiar with. That's a center where individuals go during the day, but they don't spend the night there, and they generally don't have really acute or serious conditions. And you can read the rest of these as you go through these definitions in the slides. Hospice, I wanted to point out because that can happen either in a hospice environment or at the home. So this is care with the last stage of life, helping the client through the death process and often helping their family through that process as well. So lots of different types of providers work with hospice patients, and the goal there is to try to help them be as comfortable as possible as they transition in this phase. I left quite a few of these definitions in here, and you can review them as you go over the slides. I want to make sure that we're clear about Medicare and Medicaid. This is a health insurance program. Medicare is a health insurance program for folks that are 65 or older. It's also for folks that are disabled or cannot work. So Medicare is a large program, a large payer, and becoming very important, especially as we've got more and more people in that age group that are living longer and have more complicated conditions. Medicaid is an assistance program for low income and children. So children make up a lot of the Medicaid programs that are out there. So try to have those in mind as you're studying. And one thing I wanted you to pull out from all of this, and I know I've talked for about 10 minutes now, is to think about payment. It's a hot topic in our country today. There's a lot of issues around health reform, but when you think about Medicare being a very large influence as a payer, what are some of the things that can happen if Medicare says, we're only going to pay this amount for this type of service? Um, that could be good in some ways because it's controlling costs, but it could be bad in other ways because occasionally there are providers that don't accept Medicare clients because they can't afford it, because the reimbursement is too low. So then we end up with potentially lots of folks who are on Medicare who don't have a provider. So it can be an issue. It can go both ways, which is what this question is getting at. Finally, I wanted to mention home health agencies, big employers of home health aides or personal care attendants, and I'm using those terms interchangeably. These are businesses, usually private businesses, that provide those personal care services in the home, and they help to administer and coordinate those services. And here's a typical home health agency chart. You can go over that at your leisure, but you can see here that the home health aides are working very closely with the nurses and the therapists, and especially the RN case manager, as they're managing that client's care. Okay? All right, so that's it on Chapter 1, and I'll see you for Chapter 2.